Good morning. My name is Ann Matalonis, and I'm the Director of Development with IRMA. And today we have a great, exciting webinar on the importance of optimizing your options during the open enrollment period. In today's evolving healthcare landscape, offering alternative options to traditional healthcare plans is essential. These alternatives provide greater flexibility, cost savings, and personalization in empowering employees to select coverage that best suits their needs. I'd like to introduce Esther Viti, who's the Vice President of Viti Financial Services. They're a longstanding family-owned independent agency that's been in business since 1938. She specializes in assisting businesses such as yours with group and executive benefits since 2004. She's dedicated to her clients, prioritizing their needs and fostering strong connections with various vendors and insurance firms. Esther?
Thank you, Ann. Hi, as Ann said, my name is Esther Viti, and I'm with the Viti Companies. We've been a partner with IRMA mission partner since 2022. My grandfather started the business 85 years ago, and my sister and I are third generation. We are full service, and we have a wide range of insurance products, which include personal, commercial, life insurance, health insurance, employee benefits, executive benefits. We have been in the business for many years. It's very important to us to deliver like a personalized customer care to our clients. And so that's what brings me into introducing Brett Kresbach from United Healthcare. As healthcare costs have continued to rise, we have had to look into alternate options to the traditional health insurance plans. United Healthcare has been our partner for many years. They've been a great job of delivering these products. And so with that, I am going to pass it along to Brett.
Great. Thanks, Esther. Good morning, everyone. My name is Brett Krebsbach, and as Esther pointed out, I am with United Healthcare, and today we will go over United Healthcare level funded product as well as a new innovative product called Surest. And so we can go ahead and get started on an overview of an alternative solution that's called level funded. So this is a product that is available across the United States. As you can see here in an illustration, shows based on where the employer is located, we can go down to, in some states, 2 eligible employees. Other states are down to 5 eligible and color-coded and associated to the left-hand side. There are a few states that we are not in, Hawaii and Vermont being 2 of them. But as you can see, very large scope, national presence with United Healthcare. Our medical membership is shown here on this graph. This is a snapshot of where we've come in the last 10 years with level funded. Level funded is an alternative medical plan that incorporates medical underwriting for the 2 to 50 eligible employee count size groups. So historically, starting in 2014, groups that were in that 2 to 50 life size would receive medical premiums and benefits based on age, geography or zip code in the plan design. They would remove medical underwriting from the 2 to 50 segment. And starting in 2014, we decided to incorporate medical underwriting into these premiums and into these plan offerings for groups that might be paying a little bit higher premiums for those ACA or Obamacare plans. So as you can see here, in 2014 we started, and today in 2024 we've reached beyond 1 million members across the United States that are on a level funded plan. And 88% of that membership is in that small group 2 to 50 market segment. With this type of plan, there is an eligibility or a potential for the employer to receive money back at the end of the year, and it's called a year-end surplus. So based on the premiums and the claims that come in throughout the course of the year, employers may earn money back at the end of the 12-month period, based on how many claims or claims have been filed in that segment. So here's a map showing surplus share by state based on where the employer is located. It's color coded based on 50% surplus share, 2/3 surplus share, or 100% surplus share. National average of groups receiving a surplus at the end of the year is about 42%. Illinois is 38 and Indiana is 46. Average surplus refund that employers are receiving at the end of that 12-month period is right around $9,000 to $10,000 to $11,000. We are available in that micro size groups for 2 to 4 eligible employee group size. So here's just a map showing that we've dropped to the micro size groups across the United States and which states those are based on the color code to the left. We have some changes starting January 1, 2025. First off is we have a broad pharmacy network available nationwide. Historically, we had a smaller pharmacy network that applied to our level funded groups, but we are expanding that, which includes about 67,000 retail pharmacies nationwide, also including Walgreens and CVS will both be in network across all states. And then there will be a virtual visit cost share on HSA plans or high deductible HSA plans. This is a telemedicine service that we offer on level funded through our Healthiest You partner, and a copay will apply for HSA members of $54 per visit. For non-HSA members, they can receive virtual visit telemedicine service at no cost share or for $0 copay. Mineral is a wonderful added benefit to a United Healthcare level funded plan for employers. It has tremendous amounts of resources from HR compliance and handbooks to filing 1095B and C forms, submitting information to the IRS which includes ACA reporting. And this is at no additional cost for the employer. It's a huge added administration burden that we've taken or alleviated from a lot of employers that move to level funded. And it's just a great service that we include built into these plans. The next slide will kind of show you, I believe there's some animations. Sorry, back it up one slide. And this is what it includes. The creation of these forms, securely providing data on the B series forms, electronically transmitting the information to the IRS. So for the HR folks out there, this would be a huge burden that we alleviate from you or your team. With the level funded plans, there are some benefit options that are customizable. You can adjust based on the minor lab and x-ray coverage, whether you want that subject to a deductible and coinsurance, or if you just want that 100% plan paid. That is an option that you can choose as an employer. Another option is the prescription drug list, which you can continue, Esther, on the next slide. And that's just how the prescriptions are covered. We have a few different choices to choose from based on where the employer is located across the U.S. In the state of Illinois, the Advantage, which is the richer of the two drug cards, will be the default and the only drug card available for level funded groups moving forward. There is an option for employers based on what state you're located and what effective date you're looking at. There is an option for a 15-month rate guarantee. Traditionally, policies are usually on a 12-month period. And in some states, we extend that 3 months in certain areas. So you can see here, based on the employer's state, based on the effective date of coverage, there may be eligibility for you to have a 15-month rate guarantee as opposed to a 12-year or 12-month. On the horizon, so here are some changes or improvements we're making. Surest is a type of plan, copay only plan that really brings transparency to the member before going into a doctor. So up front, we are being transparent and telling you exactly what you can expect on your EOB or your bill when you receive that after a service within the healthcare industry. And so this offer, this product is coming down to the 2 to 50, or I should say the five eligible employee to 50 eligible employee market segment, and it will be available come next year, 2025. This is a great new product that we are launching in the level funded 5 to 50 segment, and there will be more training and communications on this in the future. And then Surest, just kind of give you an overview of what Surest is. So Surest is really creating, a transparency and bringing and taking away any confusion, any wasteful dollars, and the expensiveness that comes with having insurance. It's really taking these three pain points and trying to solve them for members and just for the healthcare industry as a whole. Sure's plan is, based on clarity, experience, and savings. So in these next few slides, we can explain, what it is and how easy it is to follow along. So first off, it is available for Surest to access via mobile app or website. And this is really, designed to show you, where to get coverage, what costs it will be before you actually walk into the office. It will show members, which providers are in network, and then will also provide a range or what you can expect as a bill for any services that you plug in. So how Surest delivers results? Reduces confusion with no deductible and no co-insurance. So it's strictly a copay only plan. We offer lower copays are assigned to providers that are evaluated year after year as a high value based physician or clinic or doctor's office based on quality, based on efficiency, and overall effectiveness of care. So the lower the copay, the more high value, high quality, high efficiently that provider is. The higher the copay, they're probably evaluated as a low value based provider that has, very little quality or not as efficient as a high value provider. Copays include the services delivered in that visit, admission, helping eliminate any unexpected or surprise bills. And then members can search ahead of time, like I mentioned, before going into that doctor or office visit and understand exactly down to the cent what they will pay. So there's more to the equation that meets the eye. And this is really just to kind of look at the general information of what we have out there from having a baby to a sinus infection, MRI, or a knee replacement. This is the type of pricing that you would see, using a Surest plan and the features that come with it. And this slide just kind of shows you members choose better care options based on the provider and the evaluation of the provider. Members are going to a lower copay provider based on better results and better quality, and it's really trying to guide the member to make a educated decision on where to go and where to get care. Here's some just different facts on how many members have registered with our Surest program, and the amount of engagement, and the amount of engagement before and after a surgery. Experience for customers with Surest and UHC. The areas of alignment, same network. So Choice Plus, our largest national network across the U.S. It's a single contract, a single account management team. Banking and billing are streamlined, and members can, take it as they go. It's on your mobile phone. It's also accessible via the website or online on a computer. So next slide, you'll just show you how easy it is to use the app, and it's a lot of information. So if you have a mobile app today, or I'm sorry, a mobile phone today, you can take a picture of this QR code and run through a little demo of how Surest would work.
Thank you, Brett. That was excellent. And I just, being a broker for many years and going through the renewal process with our clients, it's been such a relief to be able to offer an alternative for the level funded plans. I mean, when they came out, I think Brett, you said 10 years ago, I felt like we were the pioneers, and, there was some confusion between United Healthcare and level funded, but now it's under one umbrella and it's been excellent. I would say people appreciate it. I've had clients get a subsidy back at the end of the year, a surplus, excuse me, back at the end of the year, which has been a surprise because no other fully insured plan works that way. And it's great to bring something that was only available to larger clients, like in the self-insured market, down to 2 employees. It's just a great way to create savings and understand your healthcare. Surest is fairly new. We have introduced this to a couple of our larger clients. We have one that is going to move forward with it for 1/1/2025. What excited this about them is just the transparency. Having the ability to see what your costs are going to be before you start a procedure and take the surprise factor away, and also making it easier to shop providers so that you can, have better value and not have to go really far and not have to do too much work. So these are 2 great options that are an alternative to the fully insured. So thank you, Brett. Now I'm going to just move on to just the communications for open enrollment. The Worksite Group has been a partner of ours for many years. They are an enrollment partner. Okay, they are available in all states. Their physical locations are in actually 4 states, but they are national. And their core services are benefits, communication, and administration, and also ICHRA administration, which I'll go into as we go through the slides. I'm not going to spend too much time on their approach, but the reason we partner with them is because there's a lot of confusion in the benefit space. Employees are not well versed as Brett and I are, because we are in the industry. And so we have counselors that are available for employees to call in. They also can use our technology. If an employer doesn't have technology, we can bring technology to the open enrollment process and have benefit coaches available to review the employee's benefits, what they currently have, how that will compare to what they're offered, and how the benefits work together to create a better understanding. So there's call centers, there's shared screen counseling, we have online scheduling, or you can call in. There's employee text. This has been a very effective way to reach out to the employees and remind them about open enrollment. And then we have also ICHRA administration, which I will go through with you. So this is just a way to streamline your open enrollment. A lot of times the HR or the person who's managing the open enrollment isn't as well versed in all details of the products that are available. So it's just been a great addition to our team, and it creates more excitement over some of the benefits that are available. Again, there's customized engagement. We'll get text. You can customize the communication. We can create the benefit guides. There's a scheduling link, and then we can track who is enrolled. At the end of the enrollment process, if you use our technology, we will send you a payroll report. So it makes it easy for you to figure out the employee deductions. The reason why employee engagement is so important is because these statistics just show 72% of people would like guidance on which is the best health plan for them. 44% of U.S. adults feel uncomfortable asking their HR representative because, again, it's uncomfortable sharing your health insurance needs to somebody at work. And then a lot of times people just call friends and family. They might have a broker friend in the business People refer to their spouse or their parents. This is just a great way to have a professional walk them through the benefits that are available. So it's an all-in-one benefit solution. You can use as much of this as you like. You can use our technology. Employee Navigator is compatible to a lot of payroll systems, so you can link them together. We can also create a link to the insurance carriers. This can help. Employee Navigator can alert you when employees are eligible for coverage. The employees have their benefits package all in one place. It manages the contribution levels for you, and then it also has customized reporting capabilities. It's very similar to a payroll system if you purchase their HRM, but it's less expensive than doing that. So in some cases, it's a better option. One thing I'd like to bring up right now is an ICHRA. An ICHRA is an individual coverage health reimbursement arrangement. Now, the majority of our clients use a group health plan. That is what is preferred for our client base. But now with healthcare costs changing for a certain size employer, it may be a better option to set up a health reimbursement arrangement where an employer will fund the ICHRA with a defined amount of money, and the employees can buy a qualified individual health insurance plan off market. So it wouldn't be a group plan. It would be money that's provided to the employee to buy an individual health plan. So the employees have the option to either waive the ICHRA that's offered or to buy their own individual insurance. This just provides people a freedom of choice. In some situations, an HR person or an employer might not want to be responsible for choosing the company. So these health plans are offered first. They can offer up to 7 plans, and the employer can choose what the best plan is for their family. If they decide they want to purchase their own plan in their individual state, that's allowed too. There are some negatives to this as well, but it's just an option that is available to you. And the premiums are just calculated, by the employee's age, county, their tobacco usage. It is guaranteed coverage. Pre-existing conditions will not affect the eligibility or the rates. The rates are definitely determined by the individual market. And so the employees, again, just offers a little bit more flexibility. It's like the employees going onto an individual exchange, but the premiums are defined and set up by the employer. So this is how the contributions work. The employee gets a certain amount of money. For example, let's say in this case, it's $577.83. Each employee has the ability to pick an individual insurance plan that fits their family's needs. If that plan is above the contribution, then the employee will have to pay the difference. But they'll have 3 options. So in some cases, ICHRA might fund it 100%. In other cases, it may not. This is just a software program that we can use that makes this process streamlined. If you're interested, I recommend reviewing that. Again, it's just very easy to enroll. It's a multi-step enrollment, but it makes it simple. It lists the carriers, it lists the deductibles, it will list a summary of benefits. And so this is just something that is available. It's really used more with a larger employer. Again, it offers flexibility. You don't need to have the renewals every year where you've seen significant increases, and it's just an option. Some of the negatives I will say is that employees may not want that flexibility. They like the idea of the larger health insurance carriers. But again, this is an alternative depending on your situation that may be an option for you. And if you're medical eligible, this is something that is also available. You can still use the ICHRA contributions towards your Medicare expenses. So that contribution can be used not just for individual health, but can be used for Medicare expenses. So this is just an example of some savings, a cost study. Again, this plan is for larger employers over 100 employees. It may be a good option. I recommend you reach out to us, the Viti companies, if this is something that you'd like more information on. So with that, I am going to end the presentation and thank you for your time, Brett and Anne. And hopefully this was helpful, but I encourage you again to reach out to the Viti companies if you'd like more information to review any of these options.
Thank you so much, Esther and Brett, for providing that information to our members. If you are an IRMA member and you'd like to reach out to Esther for more information, you could visit our website at irma.org. We have a partner page, and you can email her from there, or you can, Esther, why don't you give out your phone number real quick?
My phone number is 847-266-4035. You can reach me at my office at 847-266-4035.
All right, thank you. I appreciate everyone being on part of this today, and hopefully you got some great information out of it.
Yes, thank you again. Bye.